Great, thank you very much, Michael. As you said, I'm here with Micha. My name's Jonathan Erskine. I'm Executive Director of the European Health Property Network. I'm also a non-executive director on the board of North Tees and Hartlepool NHS Foundation Trust. We have two representatives from them with us today. I'll just hand over to you, Micha, just to introduce yourself.
Absolutely. So I come from this column here that is called consulting. I work as a change manager in healthcare and predominantly work in Sweden and Norway in actually improving the future healthcare buildings and align them with the organization. And that's a little bit also at the core of today's webinar. I'm Swiss originally, and as I said, I am now at the moment living in Sweden and driving our Walker project franchise here in Scandinavia from here. Around half a year ago, we started this initiative together with Jonathan and Flemming Schmidt from Ramboll in the beginning. What we actually saw is that in a very short time, surprisingly similar approaches emerged in response to COVID-19. In the middle is the so-called the original prototype from Wuhan, and if you look at these temporary care facilities, they all look very, very similar across the world. At the same time, we also saw that there are significant differences in the way they are used, and as well, already in the first webinar, we saw also approaches that said, no, we don't set up an external facility, so we don't relocate our care, but we rather reorganize our care facilities or reorganize our staff. And that made us curious to actually see, okay, what can we learn from each other, to collect different case studies, to compare them, and to also synthesize the findings. And that's what this project is about. Jonathan will say a little bit more about that in just a moment. So it's really about facilitating this learning process. And along the way, we had the pleasure to actually, together with the European Health Property Network and Ramboll, to also welcome white architects on board. So as you can see, it has become a pretty Scandinavian initiative, but through the European Health Property Network, we are very happy that we seemingly can also spread it beyond Europe and even further. When I look at the participant list, also at this point, thanks a lot to the financiers of this initiative. It's the Ramboll Foundation in Denmark, the Forum Vårdbyggnad in Sweden, and the Wide Research Lab. These three are very important, so we can make this initiative happen. So our goal with the project is really to collect, sort, analyze, and share knowledge, mostly from what have acute hospitals done in the first wave of COVID-19, and we really want to focus on what made them more or less resilient during that time. We call this approach compare and contrast, so we don't only want to find similarities but also differences, also be mindful of the context, and really deepen the understanding of the choices taken by the leaders. And we have a pretty broad perspective on that, from design, engineering, processes, and planning, and these are also the competences that are represented in the project team. We talk about resilience. It's a word we hear a lot about, and I just, before we start, we just want to kind of share a little bit with you how we think about resilience. And we took a pretty broad and basic definition of resilience, really to think about the capability to maintain and to adapt critical functions when faced with changes. So our wish is it also that we can actually learn beyond this specific COVID-19 pandemic, and also actually make a more general learning synthesis also for other changes or external shocks that are underway. We will look a little bit, okay, how have we prepared the organization or the buildings? How did we protect infrastructure and staff. How did we respond more concretely? How did we decide? And also now, especially in the phase we're now, where some countries are for now in a recovery mode, and see also how do we go from an emergency state into a new normal state, so the recovery phase. And you will see we have a couple of webinars planned, and we have actually 4 topics, the 4S of our project. It's staff, where we will talk mostly about the psychological and the organizational resilience. So that's kind of independent of infrastructure. Then systems, where it's a lot about business continuity and critical functions. Space, where we will have a seminar on the 16th of October, where it's about the robustness, the flexibility, and the adaptability of the space. And also take a broader stance on supply chains. So what can we actually do in terms of ecosystem performance, where there we will take a transnational or even a global perspective on resilience. So resilience is really what all these case studies are circling around. And Jonathan will now take over and explain a little bit what we're concretely doing.
Yeah, thanks, Micha. I'll ask you to drive the slides if that's okay. So as Micha outlined, we've got a number of webinars. We're also doing some other work behind the scenes in gathering case studies. We already had one in May that some of you may have attended, which was a kind of general view of the spectrum of response in the hospital world to the challenge of the pandemic. Today is all about leadership, staff resilience, and simulation and modeling to help prepare for the future and help give staff confidence in the way that we're prepared. And as Micha said, we've got a couple of upcoming seminars in October and November, and we'll remind you of those towards the end. So if we could go to the next slide, please. Yeah, so what we're hoping to get from the project, apart from the outputs from the webinars, are a number of things. First of all, we're planning what we call a field guide, which is in essence gathering together as many case studies as we can from across Europe and beyond, which are real cases of how hospitals and other healthcare organizations have reorganized themselves in the light of the COVID pandemic. And we're going to synthesize those findings, write some material around that, and keep it interactive and dynamic on a website that will communicate to everyone who's attended these websites and beyond. And in essence, this is for senior managers, policymakers, and so forth. Yeah, if you could just go back there, thank you. Hospital planners, obviously, and political stakeholders as well. I think we've already alluded to what the building blocks are, the challenges, the processes, the solutions, and the outcomes. So if we go to the next slide. Thank you. Yeah, this is just to note that we've already gathered around 40 case studies in some detail, most of them from Europe, but we're adding to this all the time. The project's going on at least until the end of this year and into next year, so I'm sure we'll gather many more. And at the end, we'll come back to you and give you some ideas of how you could contribute to that effort. I should possibly at this point just point out that this is a non-profit effort, and we want to make as much of this knowledge public as humanly possible, subject to occasional issues of confidentiality, but it's going to be out there for everyone to use. Okay, next slide, please. Yeah, so this is how we're going to engage with you. We would like you to take part in future webinars. We're going to ask you what you'd like to focus on. You can, of course, submit any case study that you wish in the field, and we'd welcome your challenge. We'd like to know from you what you'd like to see, where we should focus, and where you disagree with some of our conclusions. Next slide, please. Right, so today's focus, as we said, is on staff and resilience, leadership, the strategies for decision making, and encompassed within that, of course, we have our colleagues from ProModel who are going to talk about the issues of simulating the future and trying to look ahead as to how we can best respond.